Hello, everyone, and welcome to Z Talk. In this particular session, we're going to be talking about COVID. And I know it's not my typical conversation. I talk about technology and business and everything, but my friend and brother, Dean Morrison, introduced me to a gentleman called Mike ter Maat. He's on the show here with us. I'll let Dean do a introduction on Mike, but Mike has a very interesting perspective on COVID that we're going to talk about today. And I hope you all find this interesting, food for thought. I mean, this is not about left versus right or nothing. This is just a conversation about some realities that we should all be thinking about and paying attention to as we go through this, through different cycles of this pandemic. So thank you, Mike, for being on the show. I appreciate it.
My pleasure.
And Dean, my friend, thank you for putting this together. So I must give kudos to Dean for being the quarterback on this one. So
absolutely, Henry. It was an opportunity to be the first guest to appear 2 times on your podcast. So,
yes,
but
sure.
I did want to introduce Mike. I know Mike, and I've heard his presentations on this subject matter. And I really can't think of too many other topics that are as timely as this and touch us in so many ways. So Mike's a 10-year police officer in Broward County, Florida, and his prior 25-year career has been in finance and economics. He's worked with banks. He's worked in the White House Office of Management and Budget, and he has a BS in aeronautical engineering, and an MBA from Rensselaer Polytech Institute, and MS and PhD degrees in economics from George Washington University. So very capable, and we're very happy to have him with us tonight.
For sure.
Thanks, Mike.
Well, thank you, Dean, and thank you, Henry. I appreciate the chance to talk to your audience. It's always a lot of fun to speak with technologists, and you're right, it's probably off the beaten path for some of your folks, and we're not going to talk too much about technology. But I do think that your audience's perspective on the integration of not just technology per se, but how you look at data and how you think through some of the issues of managing information and how you think through the issues of trusting information and collecting it, using it, processing it, and turning it into public policy. Those are all things that your audience is well versed in and used to thinking about. My job here tonight with you all is not to try to convince you that I have any answers. Indeed, if I accidentally lead anyone to believe that I have an answer to any of these important questions, I have sorely misled you. What I'm going to do is try to give you a framework for thinking through some of these things. Indeed, as I speak to everybody that I know that looks at these very important questions, I think if there's anything at all that should be in consensus, it is that we probably won't understand all of what we wish we knew now until much later than even this year. You know, it's going to take a long time for us to be able to look back and say, I wish we had done this, I wish we had done that, I wish we hadn't done X, Y, and Z, right? And things are changing so fast that it's even hard to think through from one week to the next. But let me step through, you know, how I think about these things. Number one is with regard to the U.S. Constitution. And for a lot of folks, this is where the conversation begins and ends. Mm-hmm. The Constitution, the Bill of Rights, does not get suspended just because there's a disease, right? And so there are those who would argue, in some ways correctly, that notwithstanding the fact that we're in it deep right now, the government just doesn't have the authority to do some of the things that it has been doing. Does the government have the authority to order a shutdown of any element of the economy, much less great patches of it, right? This is an open question. And I think the part B that goes with that is not only whether the constitutional authority exists, but whether the Constitution ought to give the government authority. And I think those are 2 very different questions. Even if you believed in one, it doesn't necessarily mean that you have to swallow the other. You know, you can argue that the Constitution does not allow certain things, but that it should. But there is value in following and adhering to the limits of our Constitution, holding our government accountable to that document, even if it doesn't feel like a very good idea to do so right now.
Right.
Just because, following it per se is important, because Lord only knows what will happen next year, the next decade, or the next century, in which we'll look back and wish that we hadn't started loosening things up too soon with regard to what it is we allow the government to do. And of course, that leads us into the discussion that's been going on, not so much the last few weeks, but certainly a couple of months ago, between the White House and state governments, right? There seemed to be some weird argument going on between whether, the president was going to allow the state governors to be the first to violate the Constitution, or whether he wanted to violate the Constitution himself. It was very hard to understand why the White House thought it was a good idea to say, we have the authority, right? The president said, I have the authority, and uniquely so, to order shutdowns, which he backed off of quickly. Just the politics of the situation alone might have suggested that it would have been more expeditious to wash one's hands of it and dump it in the laps of the governors. So that was a somewhat awkward conversation, which has gone on in a lot of state houses since. We have seen more than one governor per se argue the Bill of Rights doesn't apply here. Thanks, Dean, for mentioning. I've been a police officer for 10 years. I can't imagine the situation in which I roll up on some would-be customer, broadly defined, and bring up that argument, right? That just doesn't fly in too many quarters. And so that does bring up the question of, never mind the Bill of Rights, right? Even if you look to the state constitutions, there are those in half the states in the United States right now that are arguing that their own state constitutions are being violated. Not this year, but in previous years when the laws were enacted that gave the governors the authority to order shutdowns under emergency proclamations. Mm-hmm. And so a lot of the discussion has revolved around, well, what does it take to trip a true emergency? And what does it take to trip an emergency sufficiently that we sort of look the other way in terms of what our state constitution allows and what it does not allow? And I think that those are going to be conversations that continue on into the future. Right now, I don't believe too many people with the clout to move either legislation or even court action has an appetite for raising their hand and saying, we know what should happen now, right? And so we want to move a court injunction against what the governor is doing. There are a few holding up their hand doing that, but that would take a lot of courage in a time when caution is the watchword. So I think it'll be very interesting to see what happens legally over the next 6, 12, 18, even 24 months when we look back. Then the other thing that I think is next on our list of what to think about, more as an economist than a cop, right, is whether some of these shutdown orders, some of the quarantine orders, are a good idea from an economic perspective. In other words, never mind the regulatory authority, never mind the legal authority, never mind the constitutional violation of it. Let's suppose that the government has complete authority to do whatever it wants and to order us to do whatever we want. I think a lot of us, I put myself in this category without trying to be political about it. I think a lot of us would feel better ceding authority to our political leaders if we felt a little bit more convinced, perhaps than we have been, that they are truly wrestling with both the costs and benefits of shutting down our economy, shutting down businesses, shutting down places of worship, places of recreation, right? What have you. And I think that some of those trade-offs in terms of costs and benefits are so politically charged that they're difficult to have public conversations about.
Mhm.
So, for example, the economic literature is full of studies about what Americans and people all over the world have been typically willing to spend of their own money, right, to make themselves safer. And you can impute from that what people are willing to spend, what they're typically interested in spending to keep themselves alive, right? You can figure out that the American public, generally speaking, is willing to spend something on the order of $5 million, $10 million, $15 million per life, right? To try to save lives. That's a lot of money. And it should be, right? We like to think of ourselves in the United States as valuing the individual and putting nothing ahead of individual life, liberty, and happiness. And so, if anything, maybe we should be surprised the numbers are that small, right? This is not a conversation that's very easy to have in public. Indeed, I'm a little hesitant to have it with you all friendly folks right now, right? I'm not suggesting that the number should be this or should be that. But the fact that research has been done in the past and that these are numbers that many businesses in the United States have to grapple with from time to time when pricing all kinds of products. I'm sure that members of your audience today have been through some kind, in one way or another, right, have been through such conversations because technology is not free and technology does contribute to health and safety.
Right.
And so there are necessarily trade-offs that get made. How many of us can remember this year a conversation or even an inclination that your politicians are wrestling with these issues? I don't think so, right? I'm not suggesting that the governor of New York, should go on TV and say, well, we're going to let this certain number of people go because it's too expensive. I'm not trying to be insensitive, but when I don't want to throw anyone in particular under the bus, but when a politician says, that's it, no matter what, we're not going to let one person die no matter what it takes. I think that's a little bit of an abdication of responsibility to wrestle with these tough issues, right? If we didn't want the governor to wrestle with tough issues, then we could elect just any nincompoop, right? We all, I think, would feel better knowing, look, I don't want to make the decision. But convince me someone's wrestling with these tough things, right? And I don't also want to suggest that it's just an amount of money or it's just lives at stake. There's more than just money at stake and more than just lives at stake. You've got people's health and sickness, even if it's not just a matter of counting how many people pass away. And of course, there are issues other than money that go along with what happens when you order people to stop doing certain activities. When you shut down pieces of our economy, it's not just productivity and money that's lost. It's real human welfare. Here in Broward County, where I work, I had the opportunity to recently speak with a representative from for the medical examiner's office, and they're really getting hammered with COVID cases, right?
Right.
Rough. And so if there's anyone out there who believes this is not real, this second wave we're facing, I'm here to tell you that it is real. We don't know yet how bad it's going to be, right? We're still hopeful that it's not going to be as bad as we all fear, but it is real. Yep. But the next thing he told me was, we have a lot of deaths up the past couple of weeks from suicides, from drug overdoses, things that might be associated with not the COVID per se, but perhaps our reaction to it. And so, again, I'm not arguing, and therefore we should have done nothing in reaction to it, right? Mm-hmm. What I am suggesting is that this is a complicated balancing act, and there are huge costs on both sides, huge costs on both sides. And so one of the things that I think that we need to be better at in a political sense of thinking through is what our objectives are. Businesses are forced to think through what their objectives are, and thankfully for them, their objectives are typically simpler than in a political context, right? Most businesses are here to maximize the bottom line, and political entities don't have the good luck to have a particular target like that. They're obliged to balance things. Well, the way the economic shutdown was sold to us in the first place was not as a method by which to completely stop the tsunami of death, right? But rather a way to avoid hospitals from being overrun.
That's right. That's what I remembered too.
Yeah, which I think made sense to a lot of us. Mm-hmm. And it's important for us to remember that objective, because now that we're facing a possible, I don't know whether it's up to what you want to call a second wave or not, but certainly as we look at the fact that we haven't eradicated the virus, right? And thinking through our continued response or renewed or refreshed response, is that still going to be the objective? And if that's the objective, if that's the only objective, then it's getting increasingly hard to justify not just completely opening the economy. So we have to wait and see. Now, hospitals are ramping up again in terms of their utilization. So we have, this is a very, very tricky time. But there are those who point out correctly that our hospitals did not get inundated the first time. Mm-hmm. Even in New York City, as bad as it was, and it was horrific, right? Don't let anything I say accidentally be mistaken for suggesting there's some mitigation to how horrible it was. Our hospitals were able to deal with it on an administrative level, right? And so we need to think through if that's still the objective, or are we into some other objective? Because if the objective is just going to be, avoid death until there's a vaccine, I fear we may be setting ourselves up for a long, chronologically long bout of heartbreak and disappointment. Yeah.
I would agree.
So we worry about that. The next thing that comes up on my radar screen in terms of, I'm sort of trying to work my way down, right, from the Constitution to a more granular level.
Right.
The next thing that comes up is, in the context of setting goals and politicization, is just how politicized everything got, and relatively quickly. I've read a lot of folks who say, gee, we went a few months without it being political, and then all of a sudden it got political. Why couldn't we keep it up? And I think a lot of folks are feigning surprise that it became politicized. I actually was surprised it didn't get politicized right out of the box. And that's a bad thing, right? And it's not just a bad thing because different people have different reactions, although that can be bad too, because, we all get into fights with each other, right? You've got a mask on, I don't. I got a mask on, you don't. Now we're mad at each other. You must have voted for so-and-so and I didn't. And then all of a sudden we're punching each other in the nose. That's bad enough. But when the message, and look, if there's anything you want the government to get right, it's messaging, right? Mm-hmm. Even if you're someone who believes that because of the Constitution or because of whatever, the government doesn't have the right to shove things down our throat. the one thing you do want the federal government and your state government to get right is, give us some advice, get the message right. That message is not only muddled, right? But it becomes inconsistent. And interestingly, it's not only been inconsistent from one government entity to another, which is bad enough, but it becomes inconsistent from one time period to another as politicians react to what's going on with their constituents. And we're in this weird feedback loop where the message is affected by the people listening to it, which is, I guess, what we all learned in Communications 101, right? But this is no time for Communications 101. This is time for the government to put its big boy pants on, figure out, do masks work or not, and give us some advice.
Right.
And when we learn, as we did recently, that, look, I'm no Dr. Fauci basher, right? I know there's a lot of folks that are mad at him and, the guy's not perfect, he's made some mistakes, right? But, as a technology guy in my past, and as your audience knows, any scientist who's at least trying to do the right thing, I'm going to be supportive, right? But when we find out, as we have in the past couple weeks, that part of his motivation for suggesting that masks may not be a great idea was because he was afraid that masks were going to run into a shortage and we needed first responders and hospitals and clinics to have access to them. Now, all of a sudden, we're thinking, well, where else did the message cut corners?
Yeah.
In other words, if we can lean into transparency instead of leaning into politics, how much better would we all feel? It matters, which leads me to my next point, which is rhetoric matters, right? I'm not per se upset with the president for wearing a mask here, not wearing a mask there. But I would like it if he could, A, make up his mind what his message is going to be, and then follow it up with demonstration, right? Treat me like a 10-year-old. Show me what you want me to do and do it yourself. Because the messaging matters and the rhetoric matters. Now, when the White House fails to lean into transparency, then when they get crosswise with the CDC or crosswise with Fauci, the internal guy, all of a sudden that starts to look like politics, and now we don't know who we're supposed to be listening to. So a little bit more thoughtfulness about messaging, how to do it, and from whom. No one is suggesting, I think, that we should have been listening to a scientist and only a scientist from day one. In matters of economics, you might want to listen to an economist, and in matters of law, you might want to listen to an attorney, and in matters of medicine, you might want to listen to a doctor. But that doesn't mean that when all three of those converge, you want to listen to nothing but a doctor, right? So I get that, but that means that some more thoughtfulness should have been put together right from the get-go. And speaking of thoughtfulness, that leads me to my thought about what we're listening to for input. Go back all the way to early February, when the White House got its hands on the, late January study that came out of the United Kingdom that rang the bell on how bad they thought this was going to be. And let's all be on the same page with this, right? Let's agree that anybody willing to work hard at it that early, that took guts. I got to hand it to them. Anyone who is willing to put a study together that early with data that young showed courage. But in places like the White House and other government organizations in the United States and multilateral organizations like the World Health Organization, right? We need to get much better at digesting science. I'm not accusing them of being anti-science, and I'm not trying to be anti-science myself, but you got to know that one study does not the world move.
Mm-hmm.
And you need to learn how to take things with a grain of salt and be ready for the next study. It's, you know, it's one thing to say, what's today, July 14, that you're angry with this study or that study because it was so wrong and it was off by an order of magnitude. Frankly, that early, I'm glad they weren't off by 2 orders of magnitude, right? But it's another to completely disregard the fact that you're the one that bought into it, right? I don't think anyone in that study said, you know, in paragraph 3, and we're right, right? You know, if there's anyone in your audience who has ever published a study and said, and we're right, then, you know, then shame on them, right? As good scientists, we always warn each other, look, these are the limitations of my data, of my process, of how much time I had to look at it. This is what needs further research. These are the implications, and these are not the implications, right? Don't go running off half-cocked with my paper thinking you're going to solve the world's problems. We need to be much, much better at consuming this information. And I think that was a real disappointment that led to problems right out of the box, because the government reacted so hard with so little behind it and got such pushback, right, from so many different places. Mm-hmm. And then that fed immediately into the politics, the right, left, the Democrat and Republican, and not just the United States. And what I'd like to discuss next is why I believe that we're not going to know really how we feel about certain things until next year, and possibly the year after that. The national government of Sweden is now taking a lot of heat. You probably recall they're the ones that gave guidance that was a little bit more open, right, than their sister governments. And they looked good for a while, right? Their economy didn't dip like the others did. They ramped up. They were all optimistic about achieving herd immunity. They were the darlings of the right? Well, now they're catching some heat because their economy has faltered a little bit, not completely differently from the other nations. While the other nations' fatality rates have not caught up. And so now it's starting to look like maybe Sweden's approach was not right. I believe, problematically, that part of the reason Sweden is catching so much heat right now is not just because people think that they made a mistake. I think there's some facial egg for those who thought they should be the darling in the first place. Yep. In other words, there was this piling on effect, and now everyone's got to be mad at them to build their credibility back for having been snookered. That's the feeling, right? So many of my friends on the right jumped on the Sweden bandwagon, and now they're upset, right? They feel like, oh, you know, maybe there's something I missed. Well, sure, but there's something we all missed, right? And continue to miss, and we don't know how this is going to play out. It's far too soon for us to be mad at each other. It's far too soon for us to even know how this is going to go, much less get upset with each other. Right. So I think the politicization is not just counterproductive in an immediate sense, but in a long run sense. We need to learn to settle down let the data come, and not be so arrogant. And to bring this full circle back to how we just started our discussion, there is an arrogance that I think one has to assume upon oneself to make certain decisions for somebody else. In other words, if you're going to, never mind the Constitution, never mind the law, if you're going to tell me what to do about anything, much less not going to work, right? If you're going to tell me what to do, you really gotta be confident, right? You really gotta have thought this through. And that's what has made me personally very nervous the past few months, is that I don't get the impression that the people who are assuming all of this authority have done enough to convince the rest of us for whom they're making decisions that they have thought all of this through. And so I think that's what really makes people nervous. And for those, whether you're on the right or on the left, I think that we recognize that there are opportunities here, political opportunities. And that's going to make everybody nervous. Mm-hmm. There are opportunities for people who believe that the government should be assuming more responsibility in certain ways. And there are plenty of opportunities for those who would like to accuse the government of having not only assumed too much power, but having screwed things up. I don't think it's going to be lost on us in the long run that plenty of federal government officials were made painfully aware of the possibility of there being a virus not completely different from this one, and having done precious little to prepare us for it. And so, you know, it's one thing to come out and say, well, now we have to protect our supply chains from the Chinese because they have demonstrated that in a moment of peril, it's difficult for us to work with them. It's difficult for us to trust them. All of which may be true. But it's another thing to completely disregard the fact that we had an opportunity to prepare and we passed on it. And I think we're going to be in full recognition of the fact that there's going to be some folks seeking some political cover for that, right? Never mind our lack of preparedness. The real problem is that we couldn't get it done on short notice after I got caught with my trousers down, right? And so there's going to be politicization of preparedness, of what to do in the future, and of looking at all of our decisions up until now.
Hey, Mike, just to say that our time elements, we have about 5 minutes.
Yep.
To wrap, because we have our time limit's coming up in 5.
Good.
And the Zoom's going to take us out.
All right. What are your own thoughts?
Well, Mike, since it's a technology show,
yep,
I thought we'd hit Henry with a myth and get your take on it. So, the use of 5G networks increases the risk of the coronavirus. So they say, while myths have circulated regarding the supposed connection between 5G mobile networks and coronavirus transmission, the WHO has strongly dispelled this notion. Viruses cannot travel on radio waves, mobile networks. COVID-19 is spreading in many countries that do not have 5G mobile networks. So, Henry, what do you think?
Here's how I think it would spread. Okay, maybe I'm just a common sense guy. Okay, I'm using this phone. Okay, and I have COVID. Dean picks up my phone and uses it. At that point, we're on 5G. Nothing is happening this way, right? But you just inhaled or breathed something that I left on the phone because I had COVID, and now you got it. So you got it through a technological device, but technology itself, like you said, the 5G and everything else, that doesn't transmit
No, that's exactly right. And layering on top of that, Henry, I don't think we're to the point yet where we can do the following analysis, but I suspect that we will find that the most urban, densely packed, and travel sophisticated folks, right?
Mhm.
The Los Angeles, San Francisco, Seattle, New York City, Miamis of the world will have both greater 5G utilization and have more difficulty in controlling COVID spread.
Hey, Mike, thanks so much for doing this. Appreciate it. And Henry for having us both on.
Mike, I thoroughly enjoyed your perspectives. I mean, there were multiple perspectives within the conversation, and I took a lot away from what you said, and even changed a couple, not changed, but I just let's say absorbed some food for thought in some of the things that you said that I may have had a more traditional view of how I think it goes. And now it just prompted me to do, you know what? I need to do a little more reading, a little more research with a more open mind. And sometimes that's the challenge, okay, from this, you say the left and right in politics, all right? You know, we're all, at the end of the day, we're all Americans, we're all human beings, and we're all brothers and sisters here in America.
I think it's a tremendous challenge. That's well said, Henry. I wish you and your audience, everybody, to stay safe and to stay independent and stay independently minded.
Yeah.
And how you balance those two things out is going to have to be up to you, brother.
Well, listen,
Thanks again, Mike.
My mom always taught me to apply logic and what's right. She goes, whether you're left, right, middle, it doesn't matter. She says, you know, always do what's right and what's fair, and then let the chips fall. And that's the way I've lived my life. But you know, sometimes the political climate, you know, the winds blow you a certain way. You know, you're swaying a little bit, and you know, I don't drink the Kool-Aid, but sometimes I get swayed one way. But definitely today, thank you for bringing that perspective to me and to our audience. Mike, I'd love to have an offline chat with you, because we could probably talk for a couple hours on this, but I do appreciate you coming on the show. Dean, thank you for introducing Mike to me. I believe I just made a new friend here, so I'm really excited about you know, going forward, staying in touch and having more dialogue. So whenever you have an update to this conversation, Mike, feel free to get back to us, and let's keep it going, okay?
Thanks, Henry.
All right, thank you again. Take care. Thank you, Dean.
Good night. Good night.
Good night.